My name is Brian Davis and welcome to Davis Foot Orthotic Solutions. Today I'm going to talk a little bit about foot orthotics and the importance of shoe wear for your foot orthotics. Now, just to sort of review, a foot orthotic is designed to re-level one's foundation. So when your foot is out of alignment, what it does is it influences the whole rest of the body and can place that out of alignment. So as you walk, you run, as you stand, things are not in position where they really should be, and over time the body begins to break down, and that's when you have either foot pain or ankle pain, calf pain, knee pain, hip and even lower back pain. So a foot orthotic is designed to re-level that person's foundation to sort of minimize all those issues. And so the shoe wear itself is designed to hold that foot in position over the foot orthotic. So a stable, supportive shoe is very important for your foot orthotic prescription. So what should you look for when you're going to buy a pair of shoes for your foot orthotics? The first thing is having enough space inside the shoe for both your foot and your orthotic. So when you go and you find shoe wear, what I always suggest is reach into the shoe, and if you can pull out an insert, that's great. And if you can pull out a real thick insole, it's even better, because the more space, the better your fit and comfort is going to be within that shoe. Okay? A nice insole can give you up to 3 millimeters of depth in that shoe. All right, now the other thing that I want you to look at is the back of the shoe. And we'll start with what we call the heel counter. And the heel counter is the rear part of the sneaker or shoe. And what you want is a stable heel counter, a supportive heel counter. And one way to test that out is to take the heel counter and squeeze it. If it moves very little, that's a good thing, because that means the shoe is supported, and that's going to hold your heel over the orthotic where it needs to be. If you have shoe wear that has, you press and you squeeze and there's nothing there like this, then you don't have the best supportive shoe wear that you need for your orthotic, and what happens is you start to diminish your orthotic prescription. So always look for a stable heel counter. The other thing that I would recommend you doing is looking for a level shoe, which means that the height of the outside of the heel and the inside of the heel are equal, because most orthotics will have some sort of pitch to the heel. And the pitch is part of the prescription, and it's doing a particular job for you. And when you have a shoe wear that's not level and it's pitched itself, could double the prescription. So be careful of that. The majority of shoes or sneakers that you'll find that are pitched will be shorter on the outside and thicker on the inside. Now sometimes they'll look level, but they're not functionally. And what I'm talking about is some of the shoes and sneakers, particularly sneakers, will have material on the outside of the heel that is softer. So it squishes down, it compresses as you put your way through it. And it compresses a lot more than the inside of the sneaker. And so functionally what that does is creates a pitching or wedging of the heel that you won't want with your orthotic. Sometimes they'll look equal and you'll see that there's some sort of cell here, whether it's a gel, it's an air cell, and that's designed to compress more so on the outside than the inside, again, pitching and wedging. So try to stay away from them if you have foot orthotics that your practitioner is trying to pitch and wedge the heel a little bit. Okay? Now, the other thing that I would recommend is the length of the shoe. So always have your foot measured, and make sure you're getting the right length of shoe that fits you. And ultimately what you're looking for is when you're looking at the length of the shoe, you want to stand up. And it's actually always better to buy shoes at the end of the day than the beginning of the day, because at the end of the day your foot is a little bit more swollen, it's a little larger. When you're standing, your foot lengthens, so you always want to make sure that you're measured and you're testing your shoes out while you're standing. And you want to have at least the width of a finger. Some people prefer a thumb between the longest toe and the end of the shoe, which is called the vamp. The other thing to check and make sure that you're not too tight in your shoes is to look at the throat of the shoe, which is really the widest part of what we call the toe box area. And that correlates or corresponds to the joints of the feet, what we call the metatarsal phalangeal joints. And so that is the widest part of your front of your foot. And so you want to make sure that when your foot's inside the shoe, that you have enough room, that you actually could pinch a little bit material, that you're not being too compressed, because between an orthotic and your shoe and your foot inside a shoe, sometimes you could be a little bit too tight, and that could be very uncomfortable, and it could throw off your mechanics. So be careful of that. Lastly, you want to make sure that when you buy a shoe or a sneaker, that it bends where your foot bends. And so again, when we talk about the throat of the shoe, that is typically where the shoe breaks. So you want to make sure that the shoe breaks where your foot breaks, is at that metatarsal phalangeal joint. And you'll be surprised, sometimes you'll buy a very thick-soled shoe and it's not breaking at all. And so if it's not bending, it's going to create some abnormal mechanics that can make you even worse than you were beforehand. So when we boil it all down, the importance of a shoe wear to foot orthotics is its stability. So look for a stable shoe, look for a shoe that has adequate room in width and in length and in depth. Okay, the other things that you might want to keep in mind is, depending on what you're doing, what activity you're participating in, is that you need to think about different shoe wear for different sporting events. So if you're playing basketball, if you're playing tennis, if you're doing any activity where you're doing a lot of cutting and going to the side or pivoting and turning and changing directions, always make sure that you buy a shoe or sneaker that has a little bit more extra support around the inside and the outside. And so you always want to buy a shoe wear that's appropriate for the activity. When you are just a runner, it's perfect to get a running shoe, but you would never want to play tennis or basketball inside a running shoe, because what's going to happen is they don't provide that stability on the inside or outside. So if you're pivoting and you're turning and you're cutting, your foot is actually going to slide outside of that shoe, off that orthotic. So you'll always want to make sure that you're maintained on that orthotic in that activity that you're participating with. So you always want to get a little bit more of a shoe and more stable of a shoe depending on that activity level. Okay, well, thank you, and stay tuned for more videos of foot orthotics, and hopefully we've taught you something today. Thank you.